welcome everyone on this beautiful day. At least it's beautiful here in Maryland, and we have a bit of springtime here today. Today we're going to be speaking about data management in the electronic data capture arena. And our learning objectives for today, I'm going to speak about the regulations as they impact data management. And we've had some new ICH guidelines as well, revisions, and those types of things that might be regulations that would be indicative of when we're using computer-generated electronic case report forms and things. We'll also discuss the rationale and perceived enhancements that will lead to a greater utilization of electronic data capture. It was first brought to my attention more than 20 years ago that EDC, when I worked for Zeneca Pharmaceutical many years ago, our group, our cancer chemotherapy group, had EDC, and they were convinced that within 5 years everyone would be using it. Well, it is 2017 as we speak, and people are still doing paper studies, so it hasn't evolved as quickly as other things in the technology environment. We'll examine the changing role of the clinical data manager. We're going from, let's say, doing task-related items such as, writing queries, updating database, etc. Not that we don't do any of that anymore, but we're more of a project management role where we're managing studies rather than managing the individual task. And then I will speak to the data management documentation that will be required in clinical trial conduct. So I'm going to give you some background, though, on the regulatory environment for EDC, and we'll talk about the regulations and then the regulations that are applicable to the electronic data capture environment and then the electronic signature. And I would expect that you are quite familiar with electronic signature since you're using different applications, different EDC applications, and what the electronic signature, the importance of electronic signature is now, although we can digitally sign many things, not only case report forms, etc. So some of the high points of 21 Part 11, and you probably heard reference to Part 11, what do we need to have compliance with Part 11? And basically, this is the high points that I'm going to go over, but what this regulation requires is that you have a system which your electronic records and our signatures are trustworthy, reliable, and secure. You need to be Part 11 compliant if you are going to collect data for studies that will be submitted to FDA. If you are doing, let's say, investigator-initiated studies that are not going to be submitted to FDA, then you don't necessarily have to have Part 11 compliance. If you are using applications from multiple sponsors, then obviously the sponsor is probably going to make submission of some of your studies, if not all that you're doing, as part of FDA. So your Part 11 will be applicable. We know that electronic signatures now are equivalent to paper records and are handwritten signatures that would be executed on paper. And sometimes your sponsor may ask you to sign an affidavit attesting to that fact that your e-signature is the equivalent of a written one. We also have to have a system that discerns invalid or altered records. So when you are doing studies for a sponsor and you now have done some data entry initially, and after the sponsor runs edit checks and they come back with a query for you, and you have to update the data in, let's say, the query management component or in the database itself, there'll be a question as to why are you updating the data. And so by answering that question, by going through that whole repertoire of question and answer type thing, it documents those changes, those reasons, and who it is at that time that is making those changes in that audit trail. So this audit trail will allow someone to audit the study and find out exactly the iteration of the data from the very first time that it was put in the database until database lock. And also that signatures that are linked to an electronic record. So let's say you are identified as a data entry person for your particular study, and you go in using your unique username and password, and that will then identify you as the user, that will identify you as the person that's going in to, add new data, change data, whatever. You may not necessarily be required to sign off per se when you've done data entry, but the mere fact that you're signing in with your unique username and password will identify you in the audit trail.